So my name is Jeff Pullman. I am the global head of communications for HTC. We're about to have a very fascinating conversation with my three friends over here, fast friends. It's incredibly interesting to me because the healthcare sector for my company is my favorite. The innovations and the breakthroughs that we're making with surgical theater, with therapy for people with cognitive decline, and distraction therapy, which we're going to be talking about today, is incredibly fascinating. VR is not about gaming all the time. It's about the demonstrable impact that it has on people's lives. So I just want to introduce the panel here. I'm going to put my glasses on. So Mariya Filipova, innovation leader dedicated to prioritizing dentistry as a medical specialty.
Great. Hey, hi everyone. Great to be here.
Add on to that. That was...
Well, you said it very succinctly and very well. So I run a impact investing fund called CareQuest Innovation Partners. And we are very special in two ways. Number one, we believe that medical care and dental care need to be connected and integrated in service of you and me, the patient. And number two, we have one single LP or a funder who happens to be the largest oral health nonprofit called CareQuest Institute for Oral Health. So that gives us two things. One, long-term perspective. So we don't expect our portfolio companies to return returns next quarter. And number two, it gives us a bigger suite of tools that we could use in service of our portfolio companies. So we could do things like help states integrate dental benefits into adult coverage for Medicare. And we could also help our companies get different codes to bill and reimburse their products.
We'll come back. There's going to be a lot more to add on that. I'm just going to keep working my way across the stage. Dr. Edward Zuckerberg, pioneering. Is that offensive? Pioneering?
Maybe.
Thought leader. We'll go with thought leader.
Technology integration.
There we go. He transformed the patient experience in his office and developed an innovative design approach. And we're going to get into that. And a little bit about your wife leaving her psychiatry practice to help with the quest that you've been on for a few years. And then lastly, Kamila Chytil, a dental benefits provider running the operations of one of the largest dental groups in the United States of America.
Yes, thank you. So I represent the payer side, right? So very important and often vilified part of healthcare, dental care. My company offers benefits for about 38 million Americans, and a lot of that is really in the underserved space, right? So multiple states with Medicaid programs as well as Medicare, but we do have a commercial side as well. So we actually offer processing services for a lot of regular brands that you will be aware of, like Delta Dental, for example, and some others.
I didn't give you a chance to expand on my very brief introduction. What else? Tell me, give us another 30 seconds. Build on what I said.
30 seconds, huh?
49 seconds.
Oh, okay.
Wow.
I mean, general dentist, 45 years now. Selected a home-based practice for my format of practice. So it was really conducive to long-term patient relationships. And when you work on that kind of patient base, you focus more on, really when you're establishing a long-term relationship, you think more about the nuts and bolts of what is going to make their visits to my office comfortable. How do I make them, so to speak, married to me as in the patient-dentist relationship?
Well, I could tell you, I still have the same dentist from when I was 10 years old. I live about 2,000 miles away from him, but there's a special connection there when he does this to me. That's actually a good segue. One of the first questions we discussed is this idea that people hate going to the dentist. I'm a weirdo, I guess. I actually really like going to the dentist. My colleague sitting in the front row smiling hates it. But what's your take? Do people really hate going to the dentist? I mean, you hope that's not true, and I'm sorry to offend.
I leave the dentist on the panel to answer that question.
Well, I mean, as a dentist, we're used to hearing at the end of the appointment, hey, doc, no offense, thanks for the work, but I hope I don't see you again for a long time. So it's kind of like, making making the experience pleasurable makes it easier for us to, just feel more professionally fulfilling. And if you think about the life of a dentist from a dentist point of view, you're working on people who don't want to be there. You're spending a lot of your life in the same room, and you're stuffing a lot of things in a small space. So if you can kind of deliver the kind of, make that kind of relationship where people can actually enjoy, or maybe that's a stretch, but tolerate and understand the importance of dental health, you're on a long way to a successful.
We're going to come back in a little bit to talk about the great lengths that you've gone at your practice to reinforce the walls so that it's a little quieter. You can't hear the screaming in the back, magazines, the smell. But Kamila, you were just getting ready to jump in there. What
Yeah.
do you think people hate going to the dentist? What's your take?
I do, and I have a fun fact for the audience if they'd like to contribute a little bit to the panel. So, what industry is the only industry that has a lower NPS score than dental? Any guesses? Throw it out there. No wrong answers. Insurance is correct, and one more.
Cable television.
Yes! How did you know that?
Because I've almost gotten divorced 37 times because Time Warner Cable just really did it to us. Sorry, go ahead.
That's right. So it's a known fact, right? You're not alone in your fear. And I think that's what's so exciting about what Dr. Z has been doing for many years and what Mariya is looking to invest in. And frankly, payers care about customer satisfaction much more today than they ever have before. There's so much choice in the U.S. dental market that we really have to improve that client experience.
So that's got to be the fun part of this. And then, Mariya, I'm going to jump to you about your take on hating or loving the dentist. But it's just this conversation for the handful of people who are really actually zeroed in. The innovation that's happening right now is really fascinating. It's going to, little kids years from now are probably going to actually be jumping up and down, excited to go, which we'll get to in a second too. But what are your thoughts?
Well, it's important to think that going to the dentist also means not only taking care of your teeth, but it also means taking care of your diabetes and your heart and your mind. And so when you put the visit to the dentist in the overall context of your overall health, then that changes the perspective a little bit. Because right now, when you think about going to the dentist, we think about, well, it's an inconvenience, I gotta fit in my calendar, or you have something that is a pain that you need to solve, or frankly, you just want a brighter, wider smile. And these are the most common reasons somebody might actually be motivated to go to the dentist. On the flip side, the people who really need to go to the dentist don't, right? And the biggest barrier for that are access, cost, and anxiety, right? And so as an investor, I believe it's good business to address the patient experience, the anxiety part of it, because that would ultimately also increase access. So I invest in things that make it easy for all those anxious patients in the audience, including myself, to make it to the dentist office. And frankly, to the dentist to get to them, right? There are solutions out there that would allow you to regenerate enamel and you don't need a filling on your tooth. You could put a paste on it. And that's the exciting part, taking dentistry outside of the dental chair. And when you do have to get dentistry in the dental chair, there's all kinds of virtual reality options.
So now we're going to get into the meat of the conversation. So for the individuals out there that are anxious before they have to go to the dentist, and you're wondering what in the hell can ever be done to change that, Dr. Zuckerberg, why don't you start talking about some of the strategies to mitigate the anxiety?
So obviously, any dentist knows that people don't enjoy going to the dentist. And one of the advantages I had over my colleagues is having a wife who's a psychiatrist. So we spent a lot of time really discussing patients' dental phobias and developing approaches on how to alleviate that. And having an office in the house meant that she was around, she could give input. She was also a patient in the practice who was also a dental phobic herself. But, you know, being intelligent, she understood, hey, as much as I don't like going, I better go or it's going to be a lot worse down the pike for me. So together we dissected the dental patient phobia and looked at it, I think, in ways that no one else ever has. So there's the obvious ones.
And when you started, you had, I don't know if dentists hang out together. My father was a lawyer and was a lot of lawyers and drove me crazy. But do you have friends who are dentists or the community? When you started talking about these things, did they look at you, your colleagues, like you were crazy? Or did they start gravitating towards what you were coming up with, the new ideas to mitigate the anxiety? The dental community, initially, when you started talking about change.
You know, a lot of people just put their head down and, you know, just sucked it up and said it's a fact of life. You know, I can't change it.
Okay.
You know, we decided we're going to change it, at least in our own little niche. So whatever we control, you know, and it started with obviously the obvious stuff, you know, pain. And the root of eliminating pain as part of the dental experience is giving a wonderfully thorough, competent, and hopefully painless dental injection. Nobody likes needles, but if you can, I mean, there are definitely things you can do that many dentists aren't aware of. For example, warming the solution to body temperature, injecting it super slowly so that there's no rush of pressure from the fluid being, you know, inserted.
Still sounds horrifying, but better. But better
Relatively
for
speaking,
sure.
yes.
It works.
So
It works. And obviously, there are skills. You know, beyond what they teach you in dental school, there's a skill set in learning how to give a painless injection,
Right.
and one that works. Not one where the patient's going to say, even though their lip is numb, hey, doc,
yeah.
my tooth hurts.
Yeah.
And I wasn't one of those that said, you're imagining it, just suck it up, you know.
Kamila, I want to switch to another question here, but the challenges that large dental organizations face with this same idea, with patient anxiety, what's the ripple effect?
Well, dentistry is extremely fragmented, right? So there is consolidation that's happening, but it's not quite at the rate that you have seen in medicine, right? There are still plenty of individual providers, or maybe a group of 2 providers that are working together. So it's very difficult to invoke change in an environment that's super fragmented. So you know, every time we try to roll out a new innovation like teledentistry, for example, because there are significant benefits to that too, right? With innovation, people, for example, need drugs before they can go to the dentist. So today they go to the ER, super expensive, right? Teledentistry is a way to prevent that. But even when we try to roll something pretty simple that's been adopted in medicine 10 or 15 years ago, we get the edge case of the dentist with no internet, right? Or we get the edge case of a dentist that doesn't have a dedicated PC.
Wait.
Yeah.
Where in America we need help though?
It happens. It happens in, you know, clinics close to Native American reservations,
Right,
for
of course,
example,
of
right?
course.
So as Mariya mentioned, and as Dr. Z was saying, innovation is hard because it's super fragmented, and there's also just a resistance to change that I think is more common in this field than some others.
Mariya, what are your thoughts?
I mean, I can't stress this enough. When we talk about AR, virtual reality, or improving the patient experience, we're also talking about improving access, improving equity, and frankly, as an investor, improving cost of care. to Camila's point, over $500 million are spent every year by Medicare on ED visits related to dental pain. Guess what? What could an ED doctor do for your dental pain? They could give you pain medication or an antibiotic. Would any of those two treatments solve for your dental pain, Dr. Z? No. I mean, I don't need to be a dentist to answer that question. Yeah, but
I mean, one of the things that we got involved with very early was understanding the need for visual distraction for our patients. And one of the first things we did was we knocked down a wall between two treatment rooms and put in a 300-gallon saltwater aquarium. That was kind of like a visual anesthesia, so to speak. And it caught on so well that we created a whole fish motif throughout the office. Pictures that I took scuba diving line the halls. We even had a shower curtain with a fish theme and a toilet seat with a fish theme. And on one occasion, a dead fish that was supposed to get flushed down the toilet and didn't make it. And a patient went into our bathroom and looked between their legs. And when he came out, he said, "Hey, I know this guy likes fish in the office, but that's ridiculous."
Well, let me ask you a question. So when you first put the fish tank up, did you make the announcement? Did you just put it up and then watch, sort of sit back and watch? Did you see a demonstrable impact right away? The people were paying attention to the fish, or then you like would hit them with the drill?
you couldn't help but notice this enormous tank. And we had a lionfish in the tank as one of our fish. And the lionfish will only eat live fish. So we had to actually a couple of times a week go buy a bag of very inexpensive like guppies or goldfish. They call them
This is getting darker.
They call them feeder fish. And we drop them into the tank. And the lionfish would then chase them and eat them. And he would like.
So this is where I'd love to, and I'm going to kick it over to you, but this is where I'd love to talk to you. Sorry, go ahead.
We actually had patients, when they scheduled their next appointment, request to schedule the appointment during the lionfish feeding.
Oh, that's outstanding.
That's right.
Well, it's sort of like watching, like a show like Dateline. You want to watch people who are suffering more than you are. The fish are suffering more. They're dying. They're being devoured. And what? Do you have something to add on that, Kamila? No, sorry, you said enough.
I was going to say insurance won't cover the feeder fish for any providers in the audience.
There's not a line item for that.
No
I don't
line
think.
item.
No.
Virtual reality, yes.
We
Feeder fish, no.
We wrote it off as a business expense.
I wanna keep moving along because we're getting into some meatier subject matter here. But let's talk about the dangers of you just mentioned distraction therapy, in the form of fish tanks, and we'll get into the VR piece a little bit. But let's talk about what's really at stake here in terms of the dangers of using sedatives and anesthesia. Short-term, long-term addiction. Why don't you take that first, Dr. Zuckerberg, and then we can kind of talk about it from a 30,000-foot level.
I mean, from the practitioner's point of view, it didn't make sense to use to have a patient under general anesthesia in dentistry unless it's really the theme and crux of your practice. I mean, we have two classes of malpractice insurance. Either you're working on patients who are conscious, or you treat one patient or more during the year, you're a class 2. Yep. And the difference in premium was $3,000 a year versus $50,000 a year. So unless you're really going to have a practice that caters to patients who want to be put to sleep for dentistry, general dentists aren't doing it. There was a guy in the Williamsburg Bank building in Brooklyn, and I would send a couple of patients, not many, to him that just couldn't be managed in the office. Extreme gaggers, where if I needed to do work on a lower second molar, and once I got my instrument back there, I was in danger of having lunch brought up.
Yeah.
So those kind of people can't be managed easily without general anesthesia.
Let's talk about the concerns about addiction and substance abuse, which is obviously on the rise. And you mentioned some communities that are on the margin and suffer more from that. Is this, from an industry perspective, how big of a worry is this?
I mean, to me, I'll give you an anecdote. So we run the largest and only oral health accelerator for companies that are looking to innovate in medical dental integration. And one of our finalists, we received over 100 applicants, 11 different countries, multiple industries. You don't need to be innovating in oral health to be selling to that market, by the way. And one of our cohort companies, 5 out of those 100 we chose, only one of them is Waiver, Wideaway VR. And so we tested that. We went to one of the largest dental clinics in New England, and we asked them, if you had this virtual reality experience, we asked the chief medical officer, what procedures in the dental clinic might you want to use virtual reality with? And it turns out that it's not, we expected to see certain list of surgical procedures, most painful procedures, the scariest procedures. The chief medical officer looked at us and said, there's not a single procedure that I do in my practice that I wouldn't want to use virtual reality on. Why? Because it actually lifts off this fog of, I don't know what's going to happen in that visit. And it also shortens the chair time, the time that this patient spends in the chair with the dentist. And so anything you could do, I go back to my earlier point, improving the patient experience doesn't only impact your NPS score, it also impacts your ability to efficiently see your patients and also get patients in the practice who otherwise would not have come in. It's an access issue, it's a profitability issue, it's an effectiveness of workflow issue. And so with that in mind, I really don't think that it's only about the dangers of anesthesia. It's about how do we take dental care into overall health and get people to go to the office, to the dentist more often.
Yeah, I don't think addiction is one of the things we're dealing with when we're talking about dental phobic patients. I mean, anyone who's going to sleep for a dental procedure, that's a lot to go through for sleep, and I don't think sleep, while it's necessary, I don't think it's an addiction.
Right.
I mean, if they want to sleep, they can listen to any one of a bunch of podcasts I have out there, and I guarantee they'll be asleep right away.
Right. Got it.
But
Kamila?
Well, I was going to add that there's also a very practical component to administering anesthesia in the dentist's office, and that's a shortage of anesthesiologists. So if you can perform more procedures with less chair time that requires a specialist, that's great, right? Especially for children. And there's a cost to it, too. So there's credentialing costs. Most states have very different licensing for anesthesia than they do for general dentistry. So if you can get away from that and increase your chair time with virtual reality, there is an overall reduction in cost.
So for those of you who don't know what we're talking about, if you're sitting down in the chair and instead of staring at Dr. Zuckerberg's face as he drills in, yanks teeth, you actually can go into virtual reality and you can go walking through the forest, or you can drift through a beautiful stream of fjord, take your mind to a different place. So, Kamila, what is the barrier from where we are now to utopia in the dental office?
That's a great question, and I'm sure
I'll ask him. I'll ask him too.
The innovators will be here, but definitely awareness, cost, right? Everything that normally comes with adoption. But I do think the tide of that customer experience that is elevating for all consumers across all industries will get there with dentistry as well.
Longer term, though, you're going to save money if you get people to come in regularly. But
that's
so
right.
In terms of the hurdles,
the barriers I see are awareness, creating awareness of the availability of the technology, and ROI. The system is not terribly expensive, and yet a dentist who's doing some procedures under general anesthesia can do more procedures under local because the time to induce general anesthesia has been removed. So this is a technology that can increase the dentist's bottom line without, just by allowing the dentist to do more procedures in a shorter period of time.
Well, let me ask you, so forgive my ignorance here, but you can use less anesthesia because the mind is in a state of flow or state of calm. Is that
Well, you're going to use the same amount of local anesthesia.
okay?
You're
But-
just eliminating general anesthesia.
okay, which is a huge
And,
cost savings,
and,
right?
and even in patients who are undergoing general anesthesia, the docs are still doing local.
Right.
So it's not like you're substituting local for general. You're just removing the need for general anesthesia. And I think that, mark me wrong if you guys would know more about this, but I would think that the practitioner who's working on patients who are under general might work less efficiently. They have the ability, they're not concerned, they might be more aggressive on procedures, knowing that the patient is in, a state of oblivion, whatnot. And I think what that may actually lead to is more post-operative pain. I think the studies do bear out that patients who have procedures done under local have less post-operative pain than patients who have general anesthesia.
Why is that?
Well, one theory that I have is that when the patient's asleep, you're not afraid to be more aggressive and maybe take your time a little more, maybe scrape a little more, be more invasive in general in the surgical procedure. Whereas when the patient's under local, you want to minimize the time to get them in and out of the office.
Right. They may be looking at a VR headset, but they can still reach over and grab your arm if it starts hurting too much. Tell me a little bit about
Well,
it.
I do want to, I 100% agree with Kamila and Dr. Z on the barriers, but I want to point the obvious here. Contrary to what the expectation is, health plans, dental plans, providers are at the table. The integration of the dental side and the medical side, yes, it's a complex problem. Yes, we haven't solved for it, but there are plenty of analogs where there are complex issues that haven't been done before, and yet we've solved them in other industries like finance, like e-commerce, like quantum computing. There's no shortage of technology and innovation that couldn't basically overcome some of the technological issues or some of the access and other barriers. So what I would like to see more is more innovators who are attempting to make that value prop for a health plan or a dental office or a provider, to where taking care of the patient experience leads to better business outcomes and clinical outcomes, because that's a fact. And so we're seeing so many startups in other industries making that attempt and making that value prop clear. We need more shots on goal. And so whoever in our audience, how many of you are in healthcare? All right, not many. You should be. It's a $4 trillion industry with so much cost and spending in healthcare. How many of you are in dental or oral health? None. Well, there you go. That were our friends
Those
here.
guys look familiar.
And you should be, because it's a $160 billion spend industry a year. That's only on the government spending and health plan spending. And so there's a huge market there. And I really want us to make sure, going back to the awareness point, that awareness goes both for the industry insiders, but also the innovators and the startups who are outsiders to that industry. We want them to take more shots on goal.
So let's talk about the innovators. Do you feel like there's a movement now that's happening? I mean, people are much more aware of VR. There's a couple of companies out there that have been really driving this. Ours has tried hard to do that. So people are slowly becoming aware of what's happening in the enterprise space with healthcare, et cetera. What do you see in the dental community when you're cruising around at conferences? Do you see this sort of taking root? Do you feel like it's on the cusp of big change?
I don't see VR. I see lots of TV screens mounted on the ceiling, mounted on the walls, for the patients to watch TV during a procedure.
Right.
But those aren't totally immersive. Those aren't blocking out what's going on. It's nothing like VR that just shuts out visual and audio, noise suppression as well. So it's coming, but hopefully, waiver is on the cutting edge here.
So it's baby steps still. Baby steps with
Yeah.
fish tanks, different magazines, smells, fish attacking other fish. But VR headsets are slowly, okay. Let's talk a little bit, like, I think the breakthrough, I'm trying to figure out, my son's 20 and 17, generally okay with going to the dentist, but this is a big part of it. Like, if you start with the kids and they're like excited because they know maybe they can't afford or don't have access to a VR headset at home, but they're going to go to the dentist and have a cool opportunity. That's a big part of this, right? I mean, starting with that younger generation to get them excited about going in. From your perspective, when is that going to take place?
Well, children are the most largely covered group in underprivileged communities, right? So Medicaid in almost every state, including the red states, covers children. So Texas, for example, is one of the richest Medicaid plans in the world. So dentists are very willing to work on children in Texas, and they're also very well compensated for it. So I think focusing on that chair time for the provider to make sure that it's not a fear, that parents are willing to bring them in, to your point, because the experience is more positive, I think would help with that awareness and would also help with the economics, very much so.
Got it.
The dentist that gets to work on a young child really needs special skills. And there's a lot at stake. The foundations for that person, their life as a dental patient, are being set and established when they're young. A dentist who ruins them will scar them forever. And we had a patient who had the mother said, my daughter has multiple toothaches. I haven't been able to get her to the dentist since she was 4. She's 19 now.
Just
Now
14.
that borders in some states as child abuse, not bringing your child to the dentist. But at that point, we just wanted to help the child. So my wife, the psychiatrist, had multiple phone calls with this child. Oh, she's 19 now. She's a young woman. And finally got her to come in. And she was actually looking forward to getting the problems in her mouth fixed. My wife convinced her we'd be painless and solve her problems. And she walked in the office, scanned the office, and fell down to the floor in a heap and started crying like a baby.
At 19.
Yeah, we later found out that she spotted the Highlights magazine on the magazine rack. And her last dental experience at age 4, the dentist who was mean,
Yep.
who she didn't like, had Highlights magazines.
Okay, well, I asked a little bit about this before, but literally it was reinforcing the walls, changing the smell, and getting rid of magazines that are often associated with other
White jackets. Patients didn't like white jackets. We found that out. We switched to colored polos. We had an office that didn't look like an office. We got, it was like walking into my living room, and it was in my house. There were comfortable chairs, and open communication, like a no desk kind of thing.
But can you take us back, because I really am fascinated by this, like the moments when you started to have the conversation with your wife. I would imagine if your wife weren't a psychiatrist, who knows what you would have done. But can you, like those initial moments when you started thinking about this, that there's a psychological aspect to this, in addition to the sort of visceral reaction to pain, but like, I'm fascinated by that. The initial couple conversations.
Well, from a competitive point of view, there's a lot of dentists, okay? And we're looking for a competitive edge. And, the insurance companies came up with a product called a preferred provider organization, or a PPO, which essentially preys on the fact that there are more dentists out there, and many of them are not busy all the time. And there are different skill levels of dentists, and there's also other factors that come into play, ethics and things like that. So, unfortunately, many patients, if they don't see the difference in care, and it's not obvious to them, and we're notoriously bad businessmen. We're trained to be dentists, not business people, not staff managers, things of that nature. So if we don't understand that well, it almost puts people who are willing to be on that list that the insurance company provides to their members of dentists who will take lower fees as like shopping for a refrigerator. Well, refrigerator here and there, same. I'll go the one who's cheaper.
Sure.
But what we thought and what we did actually prove is if you can create a comfortable, painless experience in the dental office for a patient, you've got a patient for life, a patient that's not going to switch to another dentist to save a few bucks.
And they love the polo shirts. Kamila, talk about it from the industry standpoint. It's imperative that dentists start to innovate and they start looking at creative ways. So I would sort of sink or swim. I mean, talk about that from an industry perspective, please.
Yeah, absolutely. I mean, 227 dentists in this country alone, right? So some very saturated areas. Dr. Z was super innovative in New York City. It's probably the highest per capita, of practicing dentists in the country. So I love that competitive spirit and the fact that winning that consumer sentiment is key to business. From a payer standpoint, we care a lot about quality as well. So we actually do assess providers on quality scores, on patient scores, and then, of course, on aggressiveness of diagnosis, right? If everybody walking out gets, a very expensive procedure versus a preventative procedure, for example. So, but value-based care is also a huge trend, right? So we're actually now sending members to providers who have the best trifecta of scores. So all of these types of scenarios will only help with ensuring that the right providers get the most majority of patients.
I just want to make sure that, and Kamila could tell you the story, because we talk about augmented reality as an aid to the patient experience. But if you're a dentist taking care of an autistic child, or you have to also take care of the entire family, the parents, the whole unit. And so it's not easy for the provider and for a payer to recruit providers, dentists, to take Medicaid patients. And so we were just having a conversation before the panel where there's a whole angle around making it easier for dentists to take care of these patients. Kamila, do you want to tell that story?
Sure, yeah. So dentists, again, depending on skill level and how long they've been practicing, have choice, right? Which insurance plans to take. A lot of dentists have a mission orientation where they want to serve underserved populations, but it's difficult to recruit dentists to do that, right? We end up getting a lot of the young dentists, the ones that are just coming out of dental school. So if you really want a robust network that includes professionals, oral surgeons, and dentists that are available in all geographies, you have to make sure that value proposition exists, and it's not just about fees. So, for example, chair time, again, I always go back to that because it's such a metric of productivity for dentists, but if you get a lot of cancellations, you will not see patients from a certain plan, right? So marketing to those patients, the fact that the plan offers augmented reality, for example, is a big carrot so that they're not canceling those appointments.
Well, that's where this technology is so fascinating, and for my team that runs the healthcare vertical, you look at, we have some partners that work in elderly care facilities, and talk about value proposition. If my father died of Alzheimer's last year, if he could have been in a facility that had VR, I mean, he spent his last year sort of writing, sketching maps of the ranch where he grew up. If he could have had that VR experience, that would be an incredible thing. So I think that's what's exciting to me about what you're all focusing on, that the change is coming. It is going to be, it's competitive landscape, so that's driving this. And then creativity is going to play into it, and the most creative are going to bubble up to the top.
I think the virtual reality solution to care has the potential to impact dentistry much more than other fields where the patient may have one encounter. Since this is a repetitive thing, going to the dentist on repetitive instances, and one of the biggest problems or probably the main dental disease, is gum disease. And gum disease is treatable, but it requires regular care. And I would say it was the area where my patients, and I'm sure most dental patients, were least compliant.
Who likes to floss?
So, I mean, once you're starting a root canal, most patients are going to go ahead and complete the procedure, even if it's a couple of visits. But when we make a recommendation or tell them basically you've got gum disease, you need to come in every 3 months for the rest of your life, the compliance is lacking.
And part of that, I mean, you mentioned your dad had struggled with Alzheimer's. Dr. Z could talk to us about gingivitis and what that means. But I wonder if we all knew that untreated gum disease increases your risk of getting Alzheimer's. I wonder if that would impact your willingness to floss. And so part of what we are looking to do is take the dental care conversation outside of the dental office and make it a health conversation. Make it I want to spend time with my family conversation. I want to manage my diabetes, my hypertension conversation. I want to have a healthy pregnancy. And we all know that well, maybe we don't all know, but we clinicians know that there are very clear connections between dental care, oral health, and overall health. And so that's, I believe, AR, VR would allow us to take the stigma and the fear out of that conversation. Because the first thing that somebody experiences when you say dental, and they're like, oh my God, the sound of the drill. What if I could tell you that today people could go to the dental office and be excited to have an experience as if they're going to an IMAX, because they could have Michelle Obama walk them through the White House. Yeah. That's exciting. That's not fearful. What if I could tell you that today you could go to a dental office and instead of getting a filling with that drill, you could get what looks like a paste that regenerates enamel.
Yes.
That tissue regeneration, that's exciting.
Yes, it is. But what were you saying about Michelle Obama?
All right.
I don't know. She'd have to get paid a lot of money to be.
Well, you could take it up with the guys who made it happen, because it is there. You could select your content, and it's as engaging as it gets.
You know, I practiced in the pre-social media days for the most part. So new technologies took a long time to get around. Nowadays, patients who experience this virtual reality in the dental chair are going to share their experiences with their friends and tell them. And this kind of procedure can take off more rapidly. So I think that's one advantage of this technology now versus attempts at virtual kind of stimulation that happened 25 years ago.
Well, and the headsets are getting smaller and smaller, more comfortable, less cumbersome. So that'll change as well. I mean, they're eventually going to shrink down to that size, or this size, if we're around that long. I'm not sure how we're doing on time. 5 minutes, maybe, for some questions. So Joe has a question. Did you hear that? Because I could barely hear that. Try it again because you got a mic now.
There you go.
Look, now you're famous.
What do you think the carrot would need to be for a dentist that's just practicing the status quo and wants to move into this kind of a practice? Per service, what do they have to make?
So I've been lecturing about technology for over 10 years in the dental office, and I think that what's a little bit less challenging now, maybe there's a little more business education in the schools, maybe more dentists realize that they're going to be businessmen as well as dentists, so they better have an MBA or whatever. But ROI is not, when I used to talk about ROI, dentists would like, what is he talking about? You know? So evaluating the benefits of this kind of thing, you know, yes, you have to weigh whatever the system costs to bring it into your office, but if you have the vision and you could see it fitting into your practice and understand the technology, it doesn't take a big leap to really see how this is gonna, you know, really pay off big time for your practice. So I don't think this is a hard sell on dentists at all.
What I'm basically hearing is like when rookies come into the NBA and they have to go through seminars to figure out how to manage their money a little bit better, manage their business side. So I see a similar thing happening.
I think that an MBA should be included in the dental education.
Sure.
It's already costing them $100,000 a year for 4 years.
Yeah.
From a payer side,
No, you can add on that, and then we'll give you. Go ahead.
yeah, from a payer side, it's really simple. Payers, insurance companies, taxpayers, right? So representing payers and taxpayers, they want you to focus on preventative care. So anything that gets consumers into a medical professional, whether it's dental or anything, it's all about preventative care versus large, expensive procedures. So if this experience improves the experience enough to go more regularly, eliminate that fear and anxiety, payers will support it.
So you see a virtual reality
ADA
surcharge,
code.
an ADA code for that to be added on? Okay.
We're on it.
I think we have another question. Go ahead.
Hi, my name is Homer Quintana. I'm out of Houston Methodist, and my job is medtech development. So I work with startups, medtech, large companies like Johnson & Johnson, and the goal is always, with a big system like us, is to find the value proposition to the payers, to the regulators. I missed half of your presentation. I don't know if you addressed regulatory agencies in this scenario. We are already practicing some of this VR technology for instance, treating patients with sepsis, bringing patients out of surgery and getting them to quickly recover, functioning, a few hours afterwards so anesthesia doesn't hit you as hard. So the big question is, what's the value proposition? Is there empirical data out there that you've done, maybe a clinical pilot, that validates that technology in a sense that's actually empirically valuable to not just big hospital systems, but again, other agencies that are going to take that in?
Can't afford not to do it.
At this stage in dental, no, but I know that we have a couple panelists from the earlier medical panel, and I think you actually do have some data, so thank you.
Okay, yeah, so I can talk to that. Sorry, I'm a hand surgeon, been using VR since 2016. So in terms of value, my patients are referring their neighbors to see me because I'm offering them awake hand surgery in the office using virtual reality. So if that isn't a statement of value, I'm not quite sure. But what we don't have are, yes, huge numbers to show. But we do really, because we know that it can cost up to $9,000 to do a carpal tunnel in the office. In the hospital. And we know that in my office, it's hundreds or low thousands. So we already know that there are huge differences, and that gap between the expense that we have through the main gates of the hospital and the ASC system and what you can achieve using virtual reality in the office setting, because VR releases patients from the need for sedation, already exists.
So for me, the important question is, are you getting apples to apples in the procedures? So for instance, our big thing is if we can prevent readmissions in the hospital, that saves us $40,000 a patient at minimum. And so every technology that comes across my desk, we're looking, that's just one component of a value proposition. So if you're doing your procedures using VR, what are you preventing? What are you coming?
The tables have turned. Now we're watching them.
We're the audience now.
The audience has reversed the stage now. The audience is up there. So what I showed was that the infection rates are actually higher for the basic hand surgeries in the office. In the operating room versus the office, because the office, after all, is a relatively simple environment. It doesn't require that you're in a hugely expensive operating palace. In actual fact, if you're not in these relatively dirty environments where you've got huge turnover of patients, you're actually avoiding a lot of the commensal infections that you would otherwise be getting.
Excellent, thank you. I'm going to leave it back up to
A
the panelists.
year and a half ago, I had rotator cuff surgery, and they didn't offer a local anesthesia option to me. And I remember later that night, it was an outpatient procedure. Later that night, I remember saying to my wife that I was really pissed at the surgeon that he never came by after the procedure to tell me how it went, give me, verbal instructions, I got printed pages of instructions. And my wife looked at me and said, he came into the room and spoke to you for like 15 minutes. And I had no recollection of that. So had I been under local and wide awake, I would have heard everything.
I'm pointing at my phone. The answer to all of that exists in our pockets and in the wearables that we take. It's all here. We're already building that paradigm-shifting patient experience, at least in my hospital, and it trickles down. I mean, I happen to work for one of the largest medical systems in Texas, and guess what? The data, the technology that makes it to those hospitals eventually makes it to community hospitals, but technology adoption is just so much faster these days. So it's not taking 5 to 10 years to see some of these technologies. It's taking 6 to 10 months.
Yeah, it's happening. I mean, Yale did a study. There's 6 times less mistakes that happen in the operating room if the doctor's gone through VR training. 23 or 26% faster, which I always have a sort of laugh with my boss, the founder of our company. You don't want to be in surgery for a long time. You want to be in and out as quick as possible.
Yeah, no, the big wins we're seeing are the ability of the practitioner to do more procedures in the same period of time, less cost to the insurer by eliminating the anesthesia, and less post-operative pain by the patients when the procedure is done under local than under general.
One more question.
Oh, yeah.
That's you.
Well, when I was 17, I was denied local anesthesia for the most minor knee procedure you could imagine, like scoping out a couple of little bits of cartilage. And I was mad. I told my mother, like, they're just trying to bill you for knocking me out. This is not about knee surgery. This is about... Anyway, that aside, my question, I'm trying to get it down to one, because I have many, but if VR, if the goal of VR is distracting the patient and kind of getting them in another world so you can work on them, is it a consideration that you may also want to not distract them too much, but strike a balance between that and getting them to be aware of, take initiative on their own health, and is there some awareness of what's going on that you want? Like, do you want to turn them on to dentistry as a real craft and not just like a torture chamber session? I'm wondering if that's something you think about.
I mean, every patient is different, right? So
Tell the story about your son coming to your office for his regular dental clinic. Tell that story. I think that's really the answer to this question.
I'm not sure I heard the whole question.
I think the question is, do you really want the patient fully distracted or some level of controlled distraction?
Total immersion or partial immersion?
Yeah, I mean, so my son's company bought Oculus about, I don't know the exact date, 7 years ago. And he brought it into his dental appointment with me and said, do you mind if I use this while you clean my teeth? And I'm like, sure, why not? And so he put it on, and the next thing I noticed as I'm about to clean his teeth is he became a moving target. He's going, and we quickly had to abort that experiment. Our focus here, if we're going to adopt this for dentistry, has to be on technology and programming that does not require head movements, because that won't go well for a dental procedure. But in terms of which patients are suited and for the most part, I don't need patient cooperation. I can do my thing. There's always going to be a little button where whatever they're listening to, I could hit that button and I can tell them if I need them to hear something like, "You're done now." And then they could say back, "No, my program has 5 more minutes to go. Do something else in my mouth," that kind. But, one of the options we've discussed the patients could even watch is if the doctor's got a camera on the procedure, is they can actually do VR and watch whatever medical or dental procedure is being done on them live.
Right. Well, this is one of the things about the neurosurgery work that we're doing in the city right now. The patient can actually climb inside a tumor, a VR rendering, and they can totally understand where the tumor is in their spine or their brain, and it really makes them an active participant in the treatment. It's not a small thing. So it's
and also, it's a captive audience situation, so it's a perfect time to give post-operative instructions.
Yeah. Good point.
Maybe even in something unrelated to the procedure they're going on. The ability to show them a marketing procedure on some other procedure you do in the office that they might be a candidate for.
Well, so I'll leave you with this, but the statistics are very interesting about VR learning. Reading is about 10%, lecture 5%, VR 75% retention. So if you actually included some instruction like floss, 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 floss.
Instruction.
That's something I need to talk about the team, whether we can actually somehow have some transformative experience, like a hypnotic event that can actually, maybe even during the procedure, induce some sort of meditative state during the procedure that might complement the local anesthesia.
Well, Mariya, I'll let you go, but it's also sort of like the killing of the fish. If you show shots of teeth
in addition
rotting,
to floss, I would also add, when you get home tonight, write the check to Dr. Zuckerberg.
Got it. Mariya, sorry.
Behavior change. I think that's the last mile to behavior change, ultimate behavior change. I would like to, in that induced receptive state, I would like to induce patients to talk to their dentist about their sleep issues. Talk to their dentist about their inability to stick to a diet or to their forgetfulness, because your dentist is part of your care team. And so when you think about going to the dentist, you should think about going to an oral health physician who, like most other physicians who have received high quality training, could talk to you about the connections or the investments you make in the health of your mouth and how that would pay off in overall health. So I don't want to lose that, because I want people to talk to their primary care doctor about their oral health and to their dentist about their sleep apnea and their diabetes.
Yeah.
That's the future that we're all trying to create here.
I was told that we're allowed to go 2 more hours. No. Mariya, Dr. Z, Kamila, thank you so much. It was nice meeting you guys.
Thank
Hope you guys enjoyed the conversation.
Thank you.